Hi there. Welcome back to the channel. Today we will be talking about symptoms of diabetes you must not ignore. Diabetes is one of the most common chronic health conditions worldwide. But did you know that millions of people are living with diabetes and don't even realize it? That's because the symptoms can be mild, subtle, and easy to ignore, especially in the early stages. But ignoring them can be dangerous. Left untreated, diabetes can lead to serious complications like heart disease, kidney failure, nerve damage, vision loss, and even limb amputation. In this video, we'll break down the key warning signs of diabetes that you should never ignore. Whether you're at risk or just curious, knowing these symptoms could save your life or someone else's. But first, what exactly is diabetes? Diabetes is a chronic medical condition that occurs when the body cannot properly regulate blood sugar levels. It results from either the body's inability to produce enough insulin, a hormone made by the pancreas, or the body's cells not responding well to insulin. There are four main types of diabetes. 1. Type 1 diabetes, also known as insulin-dependent diabetes. It is an autoimmune condition where the immune system destroys insulin-producing cells in the pancreas. It usually develops in children or young adults and requires lifelong insulin therapy. 2. Type 2 diabetes. This is the most common type. Also known as non-insulin-dependent diabetes. It occurs when the body becomes resistant to insulin or doesn't produce enough. It is often linked to obesity, poor diet, and inactivity and can be managed with lifestyle changes, oral medications, and sometimes insulin. 3. Gestational diabetes. This develops during pregnancy and usually disappears after childbirth. It increases risk of complications during pregnancy and delivery and raises the risk of developing type 2 diabetes later in life. 4. Secondary diabetes, or other specific types. This is caused by other medical conditions or medications, e.g. pancreatic diseases, steroid use. It includes rare genetic forms like MODY, maturity-onset diabetes of the young, and neonatal diabetes. Each type of diabetes has different causes, treatments, and risk factors, but all involve problems with blood sugar control. So what are the signs you should never ignore? 1. Frequent urination or polyuria. This is one of the earliest and most common signs as needing to pee more than usual, even waking up multiple times at night. This happens because excess glucose in your blood forces the kidneys to work overtime to filter it out, pulling more fluid from your body in the process. 2. Excessive thirst or polydipsia. With frequent urination comes dehydration. Your body tries to make up for lost fluids by triggering intense thirst. If you find yourself constantly drinking water but still feeling thirsty, it could be a warning sign. 3. Unexplained weight loss. Are you losing weight without trying? That might seem like a good thing, but in diabetes, it's not. When your body can't use glucose for energy, it starts breaking down fat and muscle instead. This can cause sudden weight loss, even if you're eating well. 4. Increased hunger or polyphagia. Alongside weight loss, many people experience constant hunger. Your cells aren't getting the energy they need, so your body sends signals to eat more, even though you already have high blood sugar. 5. Fatigue and weakness. Are you feeling tired all the time, even after a good night's sleep? High or unstable blood sugar can leave you feeling drained because your body can't efficiently use energy from food. 6. Blurred vision. Diabetes can affect the small blood vessels in the eyes. High sugar levels can cause the lens to swell and change shape, leading to blurry vision. This symptom might come and go early on but can lead to permanent damage if left untreated. 7. Slow healing of wounds. Have you noticed cuts or bruises taking longer to heal? High blood sugar affects circulation and weakens the immune system, making recovery slower and increasing the risk of infection. 8. Tingling, numbness, or pain in hands and feet. Over time, diabetes can damage nerves, especially in the extremities, a condition known as diabetic neuropathy. It often starts with tingling, burning, or numbness in your fingers or toes and may worsen gradually. 9. Frequent infections. From urinary tract infections to skin infections and yeast infections, high sugar levels create an environment where bacteria and fungi thrive. If you notice recurring infections, it may be time to get checked. 10. Dark patches of skin known as acanthosis nigricans. Look out for velvety, darkened skin areas, especially around the neck, armpits, elbows, or groin. This may be a sign of insulin resistance, a condition that often precedes type 2 diabetes. When should you see a doctor? If you're experiencing any combination of these symptoms, especially if you have risk factors like family history, obesity, or sedentary lifestyle, don't wait. A simple blood sugar test can provide answers. The earlier diabetes is diagnosed, the better it can be managed and the more complications you can avoid. Complications of diabetes. When left untreated or poorly managed, diabetes can lead to serious, often irreversible complications, due to prolonged high blood sugar levels damaging blood vessels, nerves, and organs. Major complications include, 1. Cardiovascular disease. This manifests as increased risk of heart attacks, stroke, hypertension, and atherosclerosis, that is narrowed arteries. 2. Nerve damage known as neuropathy. This manifests as tingling, burning, or loss of sensation, especially in hands and feet, and can lead to unnoticed injuries and foot ulcers. 3. Kidney damage, known as diabetic nephropathy. This may progress to kidney failure requiring dialysis or transplant. 4. Eye damage, known as diabetic retinopathy. This manifests as blurred vision, cataracts, glaucoma, or blindness. 5. Foot complications. Poor circulation and nerve damage increase the risk of infections, ulcers, and leads to possible amputation. 6. Skin conditions. This manifests as bacterial and fungal infections, dry skin, and poor wound healing. 7. Sexual dysfunction. Erectile dysfunction in men and reduced sexual response in women may be due to high blood sugar. 8. Increased risk of infections. Weakened immune system makes it harder to fight off illnesses. 9. Diabetic ketoacidosis, DKA. This is life-threatening condition mainly in type 1 diabetes, due to severe insulin deficiency. 10. Cognitive decline. Diabetes could lead to a higher risk of Alzheimer's disease and other forms of dementia. Regular monitoring, medication, healthy lifestyle, and early treatment are key to preventing these complications. So what can you do? To reduce the chances of developing diabetes, especially type 2 diabetes, you can adopt the following evidence-based lifestyle changes. 1. Maintain a healthy weight. Obesity, especially belly fat, increases insulin resistance. Even 5 to 10% weight loss can significantly reduce risk. 2. Eat a balanced diet. Focus on whole grains, vegetables, fruits, legumes, and nuts. Eat lean proteins and healthy fats. Limit sugary drinks, processed foods, processed meats, and trans fats. 3. Stay physically active. Aim for at least 150 minutes of moderate exercise per week, e.g. brisk walking, cycling. This helps lower blood sugar and improve insulin sensitivity. 4. Avoid smoking. Smoking increases risk of diabetes and its complications. 5. Limit alcohol intake. Excess alcohol can cause weight gain and raise blood pressure. 6. Monitor blood pressure and cholesterol. High levels increase diabetes and cardiovascular risks. 7. Get regular checkups. This is especially important if you have family history or risk factors. Screen for prediabetes or insulin resistance. 8. Manage stress. Chronic stress affects blood sugar and hormone balance. 9. Get enough sleep. Poor sleep affects insulin function and appetite regulation. Making these changes early, especially if you're at risk, can prevent or delay the onset of diabetes. Conclusion. Diabetes doesn't always shout, often, it whispers. That's why it's important to listen to your body. Early detection is key. By staying alert to the warning signs and taking action, you can protect your health and live a full, active life. Don't forget to like this video, share it with others, and subscribe for more health education content.